almost no surgeons. If one looks at the surgeon to population ratio, it is very low, only 0.2 surgeon per 100,000 Malawians. Therefore, non-physician clinicians known in this country as clinical officers are trained to perform essential surgical tasks. To boost the number of available surgically trained clinical officers, between 2011 and 2016, the SURG-Africa project developed and implemented a BSc course in general surgery at the College of Medicine in Malawi. The first cohorts of students included 17 clinical officers who were trained in common emergency and elective procedures on the job through a placement in 8 district hospitals. An evaluation of the program that we conducted demonstrated its effectiveness in improving surgical productivity in district hospitals and its safety. Today's study explored the barriers and enablers to retention of the SURG-Africa graduates in rural district hospitals. An interesting and relatively rare study design was chosen to help with the task. We used a longitudinal qualitative research approach. We interviewed the SURG-Africa students during their BSc training in 2015 and again in 2019, 5 years later after their graduation. Then we compared the answers using thematic analysis. Of the 16 clinical officers interviewed in 2015, 11 intended to work in a district hospital following graduation. However, only 6 eventually did so. A good few of the other ones took up employment in the NGO sector, where they made no use of the surgical skills but received better salary. It was not difficult for NGOs to offer more attractive salary package to clinical officers when the government basic pay was only around $250 per month. The other major barriers to remaining in district hospitals, as perceived by the CEOs, were lack of promotion opportunities and unclear, stagnant career progression within surgery. For those who remained working in district hospitals, offering safe surgery to rural dwellers, the main enablers were their willingness to accept this low salary, ability to engage in additional earning opportunities, their hope for promotional opportunities within the government sector, and finally, the responsibility they had and recognition of their surgical knowledge and skills as a BSc holder by their colleagues at district level. What do our findings mean? They mean that although SURG-Africa produced skilled and motivated surgical providers ready to provide their services in rural areas, the harsh reality of the district-level hospitals made most of them leave their surgical jobs looking for better opportunities elsewhere. This means that the sustainability of surgically trained physician clinicians in Malawi is not yet assured, and further work is needed to develop and implement successful retention strategies to ensure that surgical skills of these well-trained providers are available to those patients that need them the most.